Welcome to our Mary Greeley Primetime Alive presentation, Medication Management. I am Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley Medical Center. As a reminder, if you would like more information about Primetime Alive or how to sign up, you can visit mgmc.org/PTA. Our presenter today is Ellen Heikens. Ellen graduated from Drake University with her Doctor of Pharmacy degree in 2016, and she has been at Mary Greeley Medical Center for 7 years. Some of her current projects include admission medication histories, patient education, discharge teaching, and antimicrobial stewardship. Please welcome Ellen.
Hi, so yeah, like Vicki said, my name's Ellen. I'm one of the pharmacists here at Mary Greeley Medical Center. Just a little bit about me. I am from Ames originally. I graduated from Ames High in 2009. Then I went to Drake, did my Doctor of Pharmacy degree there and graduated in 2016. While I was in school, I did work at Hy-Vee for 5 years, and then I've been at Mary Greeley for 7 years now. Vicki talked about some of my current projects, admission medication histories, patient education, discharge teaching. Basically, what I'm trying to say is for the last year or so, I spent a lot of time with patients' medication lists and trying to figure out what correct medications are for patients. So I've picked up a few things that I usually recommend to people, and I'm going to try to share them with you here today. Just a little quick overview of what I'm going to talk about in this presentation. We're just going to quick define medication management and exactly what I'm going to be talking about. We'll talk about why medication management is important, what polypharmacy is and how that impacts medication management, and then some of the common medication mistakes that people make. And then we'll go on to kind of the bulk of the presentation, which will be just general tips for good and effective medication management. I've got some general tips, and then I kind of hit hard on creating the medication list because that's kind of what's important to me here at the hospital. Really quick, so medication management is just really any action that helps you use medications in the most safe and effective way possible. So all of my tips and all of my information here is just going to be geared more towards safety and efficacy of medications. So why is it important to manage medications? As far as it goes for seniors, 87% of seniors take at least one prescription medication, and just about 40 take over-the-counter medications. So the majority of seniors are taking some medications, whether over-the-counter or prescription. Kind of where it gets complicated is that 36% of seniors take 5 or more medications, which is technically defined as polypharmacy, which I'll talk about here on the next slide. So like I said previously, polypharmacy is taking 5 or more medications at a time. This becomes particularly important for hospitalized patients. In general, hospitalized patients are taking lots of medications. I would say when I review medication lists for patients here at the hospital, it's more rare for me to see someone on 1 or 2 medications than it is for me to see somebody on 12 or 13. In general statistics, about 40% are taking 5 or more, 37 are taking 9 or more, and obviously when you're taking so many medications, the chances become more and more likely that you're taking one that's not necessary. So what are some of the risks of polypharmacy? Obviously, adverse drug reactions are a risk of polypharmacy. When I talk about adverse drug reactions, I'm just talking about anything that a medication does that causes harm to someone. So, for example, if you take a medication, it makes you dizzy and then you might fall. That's what we consider an adverse drug reaction here. And that accounts for 4.3 billion healthcare visits a year, and actually up to 10% of emergency room visits. Obviously, the more medications you're taking, the more likely you're going to experience an adverse drug reaction. There's just more chance with more medications. There's also more risk of drug interactions. Obviously, the more medications you take, the more likely they are to interact with each other. 5 to 9 here represents about 50% probability of a drug interaction. And drug interactions are actual easily preventable medication-related hospitalizations that we try to prevent. And then obviously when you are taking more medications, it just becomes more likely that you're going to make a mistake. So what are some common medication mistakes that either lead to hospitalizations or adverse drug reactions? The first one is taking too much of a medication or maybe taking it too often. So maybe you thought you forgot and then you ended up taking 2 doses instead of 1. Another one is mixing up the medication and the indication. I have some examples down here. Zantac, which they just put back on the market with a different generic. And then Zyrtec have 2 different indications, but they definitely sound alike. So sometimes people get them mixed up with each other. Another one is the wrong route of administration. This is actually a pretty common medication error. Different tablets have different uses. We have like dissolvable tablets that sometimes people just swallow, or a nasal spray that somebody, uses in their mouth. I think just about every pharmacist has a story of someone that they had to remind to unwrap a suppository before they used it. So it's more common than you would think that a medication just isn't used how it's supposed to be used. Some more medications mistakes that kind of are more hospital-related, medication interactions or drug interactions like we talked about before. Obviously, more medications is a greater chance for drug interactions, and over-the-counter medications actually can interact with quite a few prescription medications. Then there are food interactions. I think people are pretty familiar with the most common food interactions. I get asked about grapefruit juice a lot when I'm doing discharge education, and that's not relevant for all medications, but it definitely is for a lot of them. And then when I'm discharging people on blood-thinning medications, sometimes those like green leafy vegetables or alcohol or anything like that can have a big impact on those. So we'll talk a bit about medication compliance. When I talk about compliance, that's just taking medications as they're prescribed. Up to 50% of patients with chronic illnesses do not take medications as prescribed, and that's even higher for patients with high blood pressure. They think mostly because you don't have any really symptoms always of high blood pressure, so you don't always think that you need to be taking your medication for that. It is pretty costly as far as healthcare costs, about $100 billion per year. And I thought this was a really interesting statement that the World Health Organization says that improving compliance can actually have a greater impact on overall health than new improvements on specific medication therapies. So what are some reasons for non-compliance? I'm actually not going to read all the reasons for you. I just want to say that taking your medications exactly as prescribed can be really complicated, and there's lots of reasons for not necessarily taking them as prescribed. And so if you are finding that you're having a hard time taking them as prescribed, you're definitely not alone, and don't kick yourself. There's ways that we can help you improve. So with that, we'll move on to some of my tips for effective medication management. The first one is how you store your medications can make a big impact. This is kind of a newer tip that I learned, but keeping all of your regularly taken vitamins, over-the-counter medications, and supplements in one location. I usually recommend like a basket or like a Tupperware kind of container. This just keeps all your medications in one place. You know where all your regularly taken medications are. It keeps things from getting lost or misplaced. With that, I would say Infrequently used medications, or maybe ones that you got refilled a couple days early, don't necessarily go in there right away. Maybe have a separate storage for infrequently used medications. And then also make sure your friends and family know where your medications are stored. This helps especially when you come into the hospital. You get asked about your medications a lot here. And so having that somewhere easily where you can just pick up your basket, pick up your Tupperware, and somebody knows exactly what you're taking right there can be really useful. Also, making sure your medication is stored properly, somewhere cool and dry. I know a lot of people like bathrooms for storing medications, but I don't generally recommend that just because bathrooms are hot and wet sometimes. Same with kitchens. If you're like near a stove or anything, that can really have large fluctuations in temperature that can change your medications. Also keeping them away from kids and pets, if that's relevant for you, that's important as well. Next, we'll talk about some tools. Pill boxes. I love pill boxes. I recommend them to lots and lots of people. And as I was getting ready for this presentation, I just took a quick look on Amazon just to see what was kind of available for pill boxes. And basically, there's unlimited options for pill boxes on Amazon. There's pill boxes shaped like pills. There's pill boxes for 3-4 times a day. There's travel-friendly ones. There's not travel-friendly ones. Basically, however you best remember to take your medications, there's a pill box that can accommodate that. I like them because they can prompt you to take your medications at regular times. You can visually see if you have taken your medication, but also if you haven't taken your medication. That's kind of where I think the pill boxes have one-ups on just keeping them in the pharmacy bottles, because then, you know, if you kind of forgot, you're not sure, you can always look at the pill box and see if you've taken it. Also, if you're not comfortable bubble packing your if you're not comfortable putting your pill boxes or medication in a pill box, you can talk to your pharmacy. I know there are several pharmacies here in Ames that are willing to bubble pack medications. I know Medicap will do it, and some Hy-Vees will do it. Sometimes there is a small fee associated with bubble packing the medications, but if that's what works for you, I think it's worth it. Reminders, I recommend reminders a lot to people too. Setting an alarm on your phone or your Apple Watch if you have one of those. A lot of people use that. When I'm talking to people who are discharging on high-risk medications, they tell me they have a pill box and a reminder set. I worry so much less about them than if they have none of those things. I also usually recommend linking your medications to other daily activities. Meals is pretty common, teeth brushing, bedtime. For me personally, I keep my medication somewhere near where my coffee machine is. And then when I go to have coffee in the morning, then I'm like, oh yeah, it's time to take medications. Another thing I usually like to recommend to people is just to know why you're taking all of your medications. That helps prevent some of those medication indication errors that can happen. It also is kind of a nice double check for your healthcare provider. So if you're like, oh, I'm taking this white medication, I don't quite remember what it's called, but it's for my cholesterol, that is usually a big hint to us, and we can usually figure out what it is just by the indication. It doesn't have to be complicated. You don't have to say like, oh, it's a beta blocker or it's this. Just saying, you know, it's for my heart, it's for my stomach, it's for my allergies. That's usually enough information. It also helps you identify medications that you might be taking for no reason. If you're like, I don't have this condition, but I have this medication prescribed. It's also good to keep these indications on your medication list. This is a newer slide I added just to plan ahead. When you have prescriptions written, it's always a good idea to ask for a 90-day supply. That's just less trips to the pharmacy, less things to remember, less opportunities to get behind on your medications. Also, signing up for automatic refills. That's kind of a newer service offered by pharmacies, but I like to recommend it. Then you don't even have to remember to call when you're running low on medication. They'll just automatically do it for you. Some pharmacies also offer sync fill, which is just a fancy term for trying to make sure all your medications are filled at the same time. This is really useful for people on multiple medications. So they'll fill you maybe 10 days, 1 month, and then for the rest of the time you're on that medication, it should all get filled on the same day every month. So that's a good thing to ask about, and pharmacies, and a lot of them will do that for you. Bubble packs we talked about earlier. And then mail order pharmacy services, I don't always recommend because there are some issues with mail order. If mail order gets behind or insurance billing, there's not always kind of a backup with mail order. But if that's what helps you remember to just have it delivered to your house, then you don't have to worry about even going to a pharmacy, then definitely do that. As far as pharmacies used, try to minimize the number of pharmacies you're going to. I know different pharmacies have different deals on medications, different $4 lists that they're using. But when you use multiple pharmacies, they're not always able to check for drug interactions with your medications, which is something that they're doing as they're filling all of your medications. If you decide that mail order is the best option for you, it's always a good idea to maintain a relationship at a brick and mortar or like a retail pharmacy. That way, if you have an emergency, you need something filled right away, you get a new script that's, maybe a high-risk medication, you have someone right there and you're not dependent on waiting for the mail to come to get your medication. I also think it's important to have a relationship with your local pharmacy or pharmacist. If they know you, they're more likely to be able to help you out when you have an emergency. This one's always kind of a harder sell, but I do recommend that people get rid of medications that they are no longer taking or are expired. So what are some reasons to not keep old medications? When I recommend this for people, they're always like, what if I need it again? What if something happens and I want it? Usually if it's expiring, you're not using it that often anyway. Expiration dates are usually the longest date that the medication can be guaranteed to be safe and effective. It's usually about a 2 to 3 year date. So keeping it longer than that, it might not even work that well anymore. Having all those extra bottles in your house just can increase the chance for it to get confused. And obviously children and pets can get into old medications. So where might you get rid of old medications? Most retail pharmacies in Iowa have a takeaway program. The only drawback with the takeaway program is that they don't usually accept controlled substances. So that is most pain medications, most ADHD medications, anxiety medications, they usually won't take. But they will dispose of your medications in a kind of an environmentally friendly way. Alternatively, in the spring and fall, there is a DEA drug take-back day. They will accept all medications at the take-back days. They usually are outside of retail pharmacies, and they usually just have a bucket that you can just take all your medications to. Alternatively, in Story County, you can take your medications to the police department. The police department will accept all medications, all drugs, no questions asked. It's simply just a drug box in the lobby of the police station where you can drop off any and all medications. You also have the option to dispose of medications at home. I don't usually recommend flushing medications down the toilet just because that can get into the water supply and that's not great for everyone. But there is a really easy way to dispose of medications at home. Generally, I recommend that they get mixed in with kitty litter or coffee grounds are the two most commonly recommended things. Basically, you just want to make it so that they're hard to get at and probably like not very good to eat if you can get at them. Just put them in a plastic bag and go ahead and throw them out in the trash. When you're getting rid of your bottle, it's always a good idea to take out all the personal information just so that doesn't get taken out of the garbage. All right, so now we're on to how to create and maintain a current medication list. I would say when patients are admitted to the hospital, this is the #1 thing that I look for as a pharmacist when I'm doing medication histories. Sometimes things can happen you don't always remember what medications you're taking. There's a lot going on usually when you're admitted to the hospital. So having a medication list available to you can really save you a lot of headache once you're here. So what do we see on an ideal medication list? We want to see all of your prescription medications, over-the-counter medications that you take regularly, and then any kind of vitamins, herbals, or supplements. Even if it's not something prescribed to you by a physician, we still want to know that can still contribute to drug-drug interactions, drug-food interactions. I had a patient not too long ago that had, it was like some kind of dried fruit supplement that he took, which, you know, could have interacted with his blood thinner. So even those vitamins and supplements, even though we kind of think of them as more dietary things, we do want to know about them on your medication list. Dosages are really important for vitamins, herbals, supplements, over-the-counter medications too. A lot of people don't remember to put those on there, and there are so many different supplements that you can buy over the counter. It's almost impossible to guess what dose you're taking. Like we talked about before, the indications for the medications, that also kind of helps identify, medications with no indication and medications that maybe aren't for the correct indication. I personally also like to know the timing of the medications. We can try to make your medications at the hospital better match what you're taking at home if we have those times on your medication list. Also just knowing how frequently they're taken. We do have standard dosing times at the hospital, but I have had patients that I've talked to that wanted to take medications at really different times. Maybe they worked overnights and wanted to have like a 3 a.m. and a 3 p.m. time. That isn't what normally is used. So yeah, having that on your medication list can let someone know how you're normally doing that. Allergies is a big one. Any medication allergies, food allergies, or environmental allergies are really important. We had a patient actually very recently who was on a ketogenic diet and could not have any sugar. So that was a really big allergy that we were always looking for with that particular person. And that actually impacted a lot of their medication and a lot of their therapy here at the hospital. So yeah, food and environmental allergies are just as important as medication allergies. Also your prescriber, who is prescribing the medication, their name and their specialty is also good to note on your medication list. Some things that aren't necessary, but I think are good to include, which pharmacy you normally use. That makes it really easy to know who to call if there are questions about, the dose or the frequency or recent changes. Also noting whoever is managing your medications, especially if it's not you, then we also know who to talk to for questions. Basically, if I could sum up these last few slides, what you want to include on your medication list is enough information so that somebody who doesn't know anything about you can know everything about your medications and can help get that all set up without your help. So here's an example. I got this for the Institute of Safe Medication Practices. This is the Universal Medication Form. This pretty much includes all the information that I talked about in the last few slides. Even more information, it's asking for address, emergency contacts. This I just Googled. If you type ISMP Universal Medication Form, this pops right up as a PDF. If you ever want to type into it or handwrite it, either works. So when are good times to update your medication list? Anytime you stop or start a medication, you want to make sure and note that on your medication list. Also, if there's any other changes, so instead of taking one, you're taking two, or taking once a day, you take twice a day. Any of those kinds of changes, go ahead and update your medication list with that. Anytime you have a new appointment, go ahead and bring your medication list and update it. They usually ask you about it a few times at appointments, so that's an easy reminder. And then at the hospital, we usually send you home with a current medication list, so that's also a good time to make sure that list matches the one you have at home. If you think you're going to have trouble updating your medication list, go ahead and ask your healthcare provider. Anybody should be willing and able to help you update that if needed. So I talked a little bit about this before. Why is it important to keep an updated list? It's nice to have just one place for all the updated information on your medications. It's also just really simple. If you bring that with you to your appointments and healthcare visits, you can just hand that to your provider and you don't have to remember everything that you're taking on the spot. For emergencies, it's really good. We have information about your allergies and medications right there. And if you're not able to help, then we have it on your medication list. So if you do have a medication list, make sure it's with you at all times. You can keep multiple copies. Some people keep a copy at home and then one copy on their person. The only drawback with that is that if you do keep multiple copies, make sure they're both, or however many you have, are always updated. So my next tip is just to talk to your doctor and pharmacist. If you have questions about your medications, if you have concerns, definitely make sure you're asking questions and don't worry about asking questions. You're not bothering anybody. As a pharmacist, it's always my goal to make sure that when you go home, you understand everything about your medications, why you're taking it, side effects, and really all of your questions and concerns have been addressed. There's lots of questions you can ask for new medications, what it's for, what are the side effects, timing. It's always good to double check if there are interactions with your prescription or over-the-counter medications. Basically, if a pharmacist talks to you about your new medication, they should be covering all this information, but it definitely never hurts to ask. All this information should also be provided in the supplemental material you get with your new medication, so it's always a good idea to read that, and then you can always ask questions about that too. So, in general, it's really a partnership between you and your providers, making sure you're asking questions, making sure they're giving you the information you need to manage your medications properly. So what are some other things you can do? Really being honest with your healthcare providers is important. If you're having trouble remembering doses, maybe they can put you on an extended release formula, or maybe they can have you do it, twice a day. I talked to a patient this week who was going home on a medication 4 times a day, and she said, this is really a lot for me to remember. Could we maybe do it twice a day? And we talked to the talked to the physician and got that worked out. So that was more manageable for her. If you're having side effects with your medication and that's part of why you're having trouble remembering, that's always something you can talk about. Maybe they can put you on a different dosage form or a different medication to take care of the same issue. If you're having trouble affording your medications, This is super common. I see this a lot, and there are usually alternatives or coupons or something that your healthcare provider can do to help you get the medication you need. I talked about before reading the provided materials that come with the medication. It should be there in really succinct, easy to read form. So if you have questions that come up from that, just make sure you're always asking them. And then always make sure you keep your medication list updated. So kind of in general, I could just tell people, whatever works for you is good. Sometimes people ask me, what's the best way to take your medication? And I almost always say, the way you're going to remember to take it is the best way to do it. So if that means some adjustments from, what they tell you exactly to do, so we can usually work something out. Please dispose of your expired medications. I know it's hard, it seems really wasteful, but I promise it's worth it. Make an updated medication list if you haven't already, and go ahead and update it today if you need to do that. And then lastly, just always ask questions about your medications if you have them.
There's at least one question here.
Okay. Yeah, we went a little quicker.
One was a comment about not getting on.
Oh, okay. So the question says, why do the clinic and hospital ask us over and over for our list of prescriptions when that information is already available in my chart? So that is actually a great question. As far as over-the-counter medications, that can change at any time, so we do have to just ask about that over and over. Unfortunately, I know it gets annoying, but it is information that we need to have. And then, yeah, we don't know if you're seeing outside providers or, somebody maybe who's not in the MyChart system. So we always just have to ask just to double and triple check that we've got the correct medications for you.
I'll open that again to see if another question came up. They can't see the questions, so.
They can't see the questions. Okay.
No other.
I don't think so.
Do you have any other things you want to say? You're good.
I do not. Okay.
All right. No, you're good. You're
Okay.
good. All right. Well, Ellen, thank you. Great information. Great job presenting. I know everybody walked away with a lot of good things, useful tips that they can use right away. And it looks like we have another question. I take a steroid that tastes really nasty. I found that putting it in a spoonful of applesauce really makes it go down easily.
Oh.
Is that okay?
Yeah, that's great. That's a great way if you have one that doesn't taste good. Applesauce or pudding are really common for people to put medications in. Yeah, I think that's a great idea. I don't know if anybody else has any tips that they want to share.
Are there any medicines you couldn't or shouldn't do that with?
As long as you're not crushing them, I don't think it would be an issue. I wouldn't crush up, extended release medications or, I would always just ask before you crush a medication. But in general, if you want to put a tablet into, a spoonful of pudding to take it, that should be just fine.
Okay. All right. Well, if any other questions pop up, we will jump back, but I will just take this back for a minute. And again, thank you. I want to remind everybody of upcoming Primetime Alive programs. We have one actually tomorrow at 2 p.m., Taking Care of Yourself While Taking Care of Others. And then you should have received a flyer recently with our August through October programs, as well as a trip we have coming up in October. So our first program in August is Wednesday, August 11th, 2 p.m., What is an Esophagus Attack? And as of right now, as a reminder, we're continuing as all of our programs will be virtual, and we'll keep monitoring that, and if we can change that, we will. I also want to remind everyone that we did not charge you again this next year. If you're wondering where, having to pay your membership, we would have sent a letter to all of you with your new cards that because we can't be in person yet, we're giving you yet another year, and then we'll resume back next year. And we have another question. Is constipation a common drug side effect?
Yeah, constipation is very common, actually, and especially if you're on pain medications, that almost always happens to people. Usually when people start narcotic pain medication, I recommend that they take a stool softener, and then if they haven't had a movement in a couple of days, to go ahead and take some kind of stimulant laxative like biscodal or something like that. But yeah, overall, constipation is pretty common, and especially if the medication can make your mouth dry, that usually means it can also make you constipated. So yeah, the short answer is yes, it is a common drug side effect.
All right. Well, thank you again, Ellen. Thank you, everyone, for joining us. As a reminder to sign up for programs, if you go to that mgmc.org/PTA, along the right-hand side, we'll list the programs, and you can sign up there. Thank you for joining us, everyone, and have a great day.